What do family pedigree charts reveal about genetic inheritance? Imagine a family tree that not only shows who is related to whom but also uncovers secrets about how traits and health conditions are passed down through generations. Family pedigree charts are powerful tools that help us understand these patterns. They are visual diagrams that map out specific traits or genetic conditions across multiple generations within a family. These charts use simple symbols: squares for males, circles for females, shaded symbols to show affected individuals, and unshaded ones for unaffected family members. Lines connect spouses and children, making it easy to see how traits move from one generation to the next. Each generation is labeled with Roman numerals, and individuals are numbered within each group by age. By studying these charts, we can identify different inheritance patterns. For example, if a trait appears in every generation and affected individuals have at least one affected parent, it likely follows an autosomal dominant pattern. This means only one copy of the gene needs to be affected for the trait to show up. Traits like Marfan syndrome follow this pattern. On the other hand, if a trait skips generations and only shows up when a person inherits two copies of a recessive gene, it is probably autosomal recessive. Conditions like cystic fibrosis and sickle cell anemia follow this pattern. In these cases, parents can be carriers without showing symptoms, passing the gene to their children. X-linked recessive traits are linked to genes on the X chromosome. Males are more often affected because they have only one X chromosome. Affected males cannot pass the trait to their sons but can pass it to their daughters, who may become carriers. Hemophilia is a common example. There are also X-linked dominant traits, which affect both males and females, but often more females. Y-linked traits are passed strictly from father to son and only affect males. Pedigree charts help identify carriers of recessive conditions, which is important for family health planning. They give genetic counselors and doctors clues about how a trait or condition might spread in a family. This information helps families understand their risks and decide whether genetic testing is needed. It also guides health monitoring and reproductive choices. In practical terms, these charts let families trace where a condition started, how it moves through generations, and estimate the chances of future children inheriting it. They help identify who might benefit from testing and what steps to take next. Overall, pedigree charts are essential tools for understanding how genes and traits are inherited in families. They support personalized health decisions and help families stay informed about their hereditary health.